You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is John Boland. John's the General Manager Hospitality Services of LHI Retirement Services in South Australia and the National President of the Institute of Hospitality in HealthCare. John, welcome to Health Professional Radio.
Thank you, Wayne.
John, we've introduced you with two titles, and I'd like to talk to you about both of them, but to start with, tell us a little bit about LHI.
Yes, LHI Retirement Services is an aged care organisation. We are based here in Adelaide, South Australia. Our particular organisation has got two villages. We've got based in the suburbs of Adelaide, one in Glynde and one at Hope Valley. And basically we look after approximately 1,000 residents between the two villages.
That 1,000 residents, that would make you a very large facility, I would have thought.
It is quite a large facility. Obviously not the largest with other organisations out there. Certainly it's the largest Lutheran aged care organisation in Australia. And we cater for approximately 500 residents at each village, and within those villages then we have independent living unit residents, people who retire and decide to live in a village, and we've got 120 residents who live in our aged care facility, which is high care dependency level residents, and it's similar at both villages. We certainly have facilities there. We've got community centres and there's a church at each site. And basically care facilities are a major focus for our aged care facilities, but we've also got care staff who work in the village looking after residents in need in the community.
I see. Now, General Manager for Hospitality Services, what gets categorised as hospitality services in an aged care home?
Well, I guess my particular role, I'm on the executive team, and I guess that role then, what I basically have to look after in that portfolio is all the catering, the cleaning services, laundry services. We've got a licensed cafe at one side. We've also got a coffee shop at the other side. We've got retail shops. So pretty much anything hospitality comes under my umbrella. I've got a staff of approximately 120. I've got some managers who work with me as a part of my team, and I guess basically we don't contract out any of our services here at LHI. We provide all the services in-house. We've got a main production kitchen that produces all the food for the residents in the aged care facility. Plus, we've got our own cleaning team, and we've got our own laundries on site, so we don't send out any of our linen or personal clothing. We do that all on site.
You're a busy man, John. I can see that laundry day for you is going to be a bit more industrious than a laundry day for me. If you've got 1,000 people to take care of.
Certainly can be. You know, even in our laundries itself, once the main laundry where we do all the linen, we've got 340 kilo washing machines up there. So, and probably around about 30 to 35 loads per week, per day, can go through those washing machines. So yeah, there's quite a bit of linen, and but look, we've got our systems and procedures and a great team of people in place that keeps the operation running smoothly.
Now, John, in your other role, you're chairperson of the South Australian and Western Australian branch of the Institute of Hospitality and Healthcare, and also the national president of that organisation. Now, tell us about that function.
I guess these roles came about from joining the Institute of Hospitality and Healthcare back in 1994, and it came through another colleague from the IHHC who introduced me to this organisation, and pretty much I just became a member initially, and I guess over time got involved with the committee, and then our chairperson at the time decided to step down. I had the vice chair role here in SA, took on the role as chair of SA and WA, and that was an automatic inclusion then on the national board as the chair of the state. You will automatically become a board member, and I guess as time went by, from being the new kid on the block on that group, I became the vice chair of that group, vice president, and eventually 2 years ago, actually in November, I became the national president.
Now, what's the function of the IHHC, John?
I guess the function, our main focus and our main goal is actually education and development, and pretty much a network for our members. Our membership is pretty much made up of similar people to myself. We've got people who are in a role of support services in an aged care or a hospital healthcare situation can become a member. I guess the organisation was born, I guess, back in 1987 from a group of, I think, about a half a dozen. It started out with food services, so around about a half a dozen food services managers in Melbourne, in Victoria, who pretty much got together over a cup of coffee, or possibly maybe a beer. I'm not too sure, but they just got together one day and discussed common issues, and discovered that, you know, we were all working in isolation, and that there was potential here to form an organisation that would be an outlet or a resource for our members to tap into and share ideas and share issues, share problems. And what became very evident before too long was, we were able to work better as an industry, and that we weren't all working in isolation. So I guess the Institute then sort of came from that early beginnings of food services, and grew over the years, and was mainly focused in hospitals in the early days. And I guess from there, from the hospitals, then we grew over the years, and I guess one of our national presidents, a gentleman by the name of Angelo Mignonelli, who was president for quite some time, had the foresight to see that the organisation would need to expand. They brought in aged care. So today, we've got a membership base, I guess, of around about 250 members all up, right across Australia. But I guess our membership is based on individual. So I guess if you take, say, myself as an example, I'm one member here in our organisation. I've got 120 staff that I'm responsible for, so we've got we probably pretty much capture, I guess, the majority of the major hospitals in Australia, plus major aged care facilities as well. But certainly bringing aged care into the fold has seen great benefits, and there's such a similarity between support services for our hospitals, and there's such a flow on between aged care and hospitals. Basically, we're all running with the same issues and the same.
Yeah, John. In every industry there are misconceptions. What's the biggest misconception in your industry amongst your clients, customers, patients, users that drives you nuts and keeps you awake at night?
Look, I guess I mean, I guess the classic one for us, even though, you know, we're support services involving, you know, other streams, you know, with cleaning and laundry services and porterage and maintenance, all those other ones. But I guess coming back to the food area, food is such a topical item, you know, that everybody certainly has an opinion on food, from a family household to, you know, an individual to, you know, we've got Master Chef and My Kitchen Rules on TV now, so there's a lot of people are very, very much the experts on food, and I guess one of the things that sort of from time to time upsets us is the perception sometimes that we hear that, you know, you hear about hospital food or aged care food that, you know, it's not at a standard that maybe people's expectations might have. Whereas, you know, when you work in the industry and you see the magnificent amount of work and the amount of efforts and innovations people are coming up with in regards to, you know, how we prepare food, how we present food, how we put choice on the menu. You know, I guess that's one of the things that, I guess with I suppose, newspapers and that line of media, I guess, you know, you quite often will hear the negative and the bad story will hit the headlines rather than a lot of the good stuff that happens out there. And I guess that's one of the sort of things that sort of can be upsetting when you work in the industry, that perception is out there, and we know ourselves that, look, obviously, unfortunately, there might be a minority of places out there that may have from time to time something that occurs, but my firm belief, you know, talking to our members, and we've just come off our national conference in Brisbane, Queensland in October, and we had 36 speakers and presenters at that conference, and to be honest with you, Ryan, the amount of innovation and ideas and knowledge sharing, you know, in regards to food service and presentation of meals, it's just, you go away so enthused, and delegates, you know, you get feedback, and you know, they feel, and one of my managers actually attended this year's conference, and she certainly got a list of tasks that she wants to introduce to our organisation that she saw at the conference. So there is a lot of good happening out there, you know, and I guess at the moment we're seeing some great interest from some of the high-profile, I guess, celebrity chefs out there. Maggie Beer has formed a foundation that is very much focused on food and aged care. Simon Bryant here in South Australia as well is involved in that. The IHHC as an organisation were invited to be part of Tasting Australia, whereas they've identified that Tasting Australia Week here in South Australia is not just about, you know, it's about the region. It's about food, wine, but certainly they've recognised the importance of highlighting aged care, and we were very, very pleased to have been given a day to be involved with Maggie and Simon, and we actually ended up having a chefs from the aged care industry cook-off, which was about half a dozen chefs came from different organisations. They were all given the same ingredients, and they were given an hour to prepare on a stage. It was outdoor actually in the middle of CBD in Adelaide, but it gave a great, I suppose, exposure to our industry that you know, we are innovative and we are actually working on certainly the presentation of a meal is so important, you know. We quite often can see you can buy the best ingredients and you can have the best chefs in the world and you can have the best cooking and the best meal being produced in the kitchens. But if the meal is served up in an unpleasant manner or in an unattractive manner, it can spoil the whole experience for, our patients and our residents.
Yes. John, it's a pleasure chatting to you. Your passion for hospitality services and aged care is obvious, but I do have to run away, so thank you for your time.
Sure.
If you've just joined us, you've just missed a fascinating chat with John Boland, the General Manager Hospitality Services of LHI Retirement Services and National President of the Institute of Hospitality and Healthcare. The good news is we have a transcript of our interview on our website. You can also hear a recorded archive on YouTube and SoundCloud, and links to both of those are on our website at www.hpr.fm. If you'd like to get in touch with John, the best way to do that is through his website or the LHI website, www.lhi.org.au. This is Health Professional Radio. My name is Wayne Bucklar.